This is ZengoMD. Let's continue our look at testosterone pellets now with part 2. Is it bioidentical? Well, we started part 1 with some evidence from the medical literature about testosterone pellets. We didn't get a lot of long-term information. We do know that when they're inserted, they do have levels that peak supraphysiologic fairly early and then decline back down, and that there's no way to smooth this out or extend this by giving more pellets. So before we continue, of course, please note the disclaimer that this is not meant to be a way to diagnose or treat any disease, and that if you're currently on therapy, including testosterone pellets, do not make changes in your treatment regimen without consulting with your own personal doctor who has seen and examined you and knows your levels fully. This is simply a discussion of human physiology and evidence from the literature. This is not meant to diagnose or treat you at all. Okay, I think I said that twice. Anyway, let's continue. Part 2. So this is what exponential decay looks like. And there's a problem there. I mean, I like roller coasters, but I don't like them running every 3 to 4 months inside my own body. And that's what happens. And that doesn't happen with natural testosterone made at the testes. So when you think of symptoms, you have to think of what these roller coaster hormone levels may do actually to the receptor. So here is a schematic of what happens to our receptors at month 1 and month 4 in the first round of pellet insertion. On the left, we have a normal testosterone receptor that is happy with a low physiologic amount of hormones. Yet in that first month, the receptor is seeing way too much. Look at all those testosterone molecules competing. That makes the receptor upregulate, meaning there is so little time where that receptor is unbound that it wants and craves more hormone because you were giving it to it. That is represented by the slight enlargement of the receptor as shown on the right. Now the receptor itself doesn't enlarge, it's just a cartoon, but more receptors may appear, and the relative hunger for all of the receptors combined increases. More so, receptors can develop what's called tolerance, where it takes more stimulation to elicit the same response. So therefore, both at month 1 and month 4, though, the receptors are pretty well saturated because this patient was probably somewhat deficient to begin with. And so the patient feels a feeling of euphoria. They feel pretty good, both at the peak and actually near the end of the 4 months of pellet therapy. So first months on pellets, as first months on any kind of high dose condition, a higher dose condition maybe than what the patient is used to, often for a lot of patients feel good. Another round of pellets brings another peak, another crash, and more receptor upregulation, as illustrated here. For many, all still good with regard to symptoms, although maybe not quite as good as last time. Let's look at round 3. Now at this point, those jacked up receptors are now only barely satisfied by the remaining testosterone at the end of the cycle. There's still plenty of testosterone to go around at the peak though, and that peak continues to create tolerance or to upregulate that receptor as well. Round 4, and still no problem continuing to oversaturate the receptor at 1 month. But now the duration of the symptom relief is shorter. And by month 4, maybe even month 3, people begin to feel a degree of withdrawal. Some even feel worse now than before they started, which was really more than a year earlier at this point. So we'll talk about some of the variables behind this, but at this point, the provider might increase the dose or possibly even shorten the duration between doses to try to get that buzzworthy response back. Well, let's say at some point, maybe the patient gets discouraged. Eventually you need to get off the ride, right? Maybe they run out of money and stop. This results in a feeling like you are making virtually nothing because the levels fall back to the untreated baseline, but the receptors are looking for the next onslaught. This receptor effect is called tachyphylaxis, and it happens in many pellet users, injection users as well, and some people even on oral high-dose therapy. But never happens in the first month, except in very, very rare cases. See, pellets can be popular because everybody likes the roller coaster ride the first time. Who doesn't? This surge of testosterone is like a surge of any other steroid hormone, creating a feeling of euphoria no matter what your level is. Even if you are already making enough testosterone to begin with, you will feel better with more, which is why so many people like their pellets in the first month and why it has such a high return rate. But eventually it can feel like a never-ending cycle with no safe point to just get off the ride. All right, back to Harvard. We've seen some of these articles before, and they delineate some well-known side effects of too much testosterone while reminding us of the difficulty of measuring it again. And we've quoted them before on this, and they're dead right. And, of course, we already have proof in the medical literature through multiple studies that pellets deliver too much testosterone in month 1. Can't argue that. The dose over 4 months might be reasonable when you take the total dose and divide it by the total number of days, but it just can't be delivered consistently. Maybe it could if you inserted the pellets every 2 to 3 weeks, but who wants to get stuck with that large bore trocar that often? And look at the potential side effects listed here. Prostate enlargement, which we are learning is due to that secondary metabolic conversion to estrogens due to the enzyme aromatase. Now you know why some of your friends on testosterone shots and pellets are prescribed an aromatase inhibitor cancer drug to help prevent the buildup of toxic estrogens. So one drug to treat the problems caused by another. Weight gain and that fat causes more aromatization because fat has that enzyme, which can create more estrogens. Blood clots, increased red cells that thicken the blood have been seen, and that increased red cells even happen in the first cycle. Finally, down here are the mood swings and the euphoria that we describe. Usually it's just euphoria early on, and then the mood swings can kick in further cycles. So let's go back to our chopped up body and follow how that freshly made testosterone absorbs and circulates in its first pass through the system. So here are the pellets placed under the skin, usually within the last 2 to 4 weeks, where we're measuring this peak. And they're absorbing into the venous blood at maximum rate since the pellets are large and fresh and have a ton of surface area. This is in addition to any current production by the testes, which could actually be significant in some men. This goes to the heart, and 20 to 25% goes to the liver. The rest of this fresh free hormone goes to the tissues. However, depending on the amount of pellets placed, this is typically an oversaturation the vast majority of the time for the tissues, and a lot of that fresh free hormone can't even be absorbed. It oversaturates the tissues, bypasses the tissues, and ends up going to the arm where it could be measured in venous blood, but back around for a second trip around the circulatory system. This, of course, increases the amount that goes to the liver, which increases the amount of binding proteins that make this process even more predictable. The more binding proteins you make, of course, the more it can tone down this excessive testosterone amount, but that's unpredictable. We don't know. And once high amounts of testosterone go to the liver, instead of being eliminated whole and bound, there's a secondary pathway of aromatizing that testosterone to estrogens, which is also more active when the liver is overloaded. And those estrogens can recirculate for an undetermined amount of time in the circulation. Of course, some testosterone and estrogens will be appropriately eliminated into the GI tract and then hopefully into the toilet, which is why we need to eat a lot of fiber, because guess what binds up excess hormones in our GI tract? Fiber. So don't just believe me that aromatization is a problem. Aromatization inhibitor drugs like anastrozole are expensive and FDA approved only for women to treat estrogen-dependent breast cancers by reducing natural estrogen production. Just look at the number of articles mentioning testosterone that also use anastrozole off-label for men to combat the metabolic byproducts of giving too much testosterone. Now, don't be confused by some of these studies being used to treat low sperm counts, because in the majority of these patients, these low sperm counts were caused by taking too much testosterone or synthetic anabolic steroids in the first place. Look, why not just get the dose right to begin with, get the levels right to begin with, instead of taking too much of one drug and then have to counteract its toxicity with another? So it's time to get to the scorecard for testosterone pellets. Is it bioidentical? This criteria is spelled out in our main video about the definition of bioidentical medicine. So let's go down the list. Structure, yes. The pellets contain bioidentical testosterone. The structure is correct. It is identical to what the testes put out. This is not a synthetic like an anabolic steroid. Deficiency, no. And the reason is that most pellet providers use serum blood testing, which does not reliably reflect tissue levels, unless the tissue levels are already overdosed, and then that person won't be getting pellets in the first place. Dose. Yes, you might be surprised by that. But if you take the typical administered dose of the testosterone pellets administered, divide it by the interval between doses, it typically is a physiologic dose per day. However, and this is a big however, duration is a big fat no, because that total dose is mostly dumped into the bloodstream in the first month to 6 weeks, causing the receptor damage that we illustrated here. Downstream, no, because men should not be making estrogens from bioidentical testosterone replacement. If they were given the right amount of replacement testosterone, their normal metabolic pathways should be able to handle it with no ill downstream effects. Definite. Are we sure that what we're replacing is physiologic? Well, maybe. We'll give this one half credit. Because if people test both saliva and blood at the 1 month mark and at the 4 month mark to tailor the dose and ensure that at no point an overdose is given, then it's possible we could be definite. But in practice, this isn't really done. So at best, half credit here, and that's being generous. So that brings our total score to a very disappointing 2.5 out of 6 total points. Yes, the duck quacking means testosterone pellets are not bioidentical, at least the way they're currently used. Of course, we'll update this as needed if practices change, but I'm not holding my breath on that one. But you will feel better the first time you get them. You may notice the withdrawal symptoms a few months after cycle number 1, or within cycle number 1. Or if you're really, really good at making SHBG, it might take more cycles. But eventually, this will be something very difficult to end. And frankly, that is why so many providers offer it. It provides happy patients at first and a fairly regular profit center for both the insertion fee and not to mention the markup on the pellet supply as well. It's lucrative. Knowing these limitations, pellet therapy still may be right for you, as long as you work to use and discover the lowest effective dose. Don't stretch the interval too far, and you also happen to make a really good SHBG response so that it handles the peak without making estrogens. And the only way to know is you want to test at month 1. Otherwise, please think twice before considering pellet therapy and consider all other options in your decision making. Pellet therapy is rarely the only option for you. Don't fall for slick marketing or promises. Well, that's all for me. Sorry it took so long. Follow us on all these channels. Thanks for watching.